My name is Kenny Signer, and doing my topic on physician-assisted suicide. The main claim is physician-assisted suicide allows for a competent, terminally ill patient to eliminate unnecessary pain and suffering. My secondary claims include physician-assisted suicide is always at the request of the patient, and the right to life implies the right to death. 60-Minute correspondent Steve Croft interviewed Ira Byrok, a physician at Dartmouth Medical Center on November 22, 2009, in a segment called The Cost of Dying. Marcia Kleisch is either being saved by medical technology or being prevented from dying a natural death. She is 71 years old and suffering from the complications of colon surgery and a hospital-acquired infection. She has been unconscious in the intensive care unit at Dartmouth Hitchcock Medical Center in Lebanon, New Hampshire for the better part of a week. Byrok told Croft it costs up to $10,000 a day to maintain someone in the intensive care unit. Some patients may remain here for weeks or even months. One has been here since May. This is the way so many Americans die. 18 to 20% of Americans spend their last days in an ICU, Byrok said, and you know it's extremely expensive. It's uncomfortable. Many times they have to be sedated so they don't reflexively pull out a tube, or sometimes their hands are restrained. This is not the way most people want to die or spend their last days of life, and yet this has become almost the medical last rites for people as they die. Dr. Byrok leads a team that treats and counsels patients with advanced illness. He says, modern medicine has become so good at keeping the terminally ill alive by treating the complications of underlying disease that the inevitable process of dying has become much harder and is often prolonged unnecessarily. Families cannot imagine that there can be anything worse than their loved ones dying, but in fact there are things worse. Most generally is having someone you love die badly. When asked what she means by die badly, Byrok told Croft, dying while suffering, dying connected to machines. I mean, the denial of death at some point becomes a delusion, and we start acting in ways that make no sense whatsoever. And I think that's collectively what we're doing. A vast majority of Americans say that they want to die at home, but 75% die in a hospital bed or a nursing home. Physician-assisted suicide is defined by MedicineNet.com as the voluntary termination of one's life by administration of a lethal substance with the direct or indirect assistance of a physician. Physician-assisted suicide is the practice of providing a competent patient with a prescription for medication for the patient to use with the primary intention of ending his or her own life. Physician-assisted suicide is often abbreviated as PAS. PAS is always at the request of the patient. Why should a terminally ill patient suffer, so to speak, as they wait to die? Many physicians feel they should not have to. They feel as if they have an obligation to their patients to relieve pain and suffering of that patient. Pain and suffering does not limit itself just to the physical. It includes psychological, social, spiritual suffering as well. And it is often a combination of all these that a terminally ill patient chooses physician-assisted suicide as a means to an end. Terminally ill people know they are going to die. Many do not want to burden their loved ones with a large debt after they have passed. They would like to leave them with positive and uplifting memories of them. They would like to die with their dignity intact. Thomas A. Bowden, an analyst of legal issues at the Ayn Rand Center for Individual Rights, tells us in his October 2007 article titled "Individuals Should Have a Legal Right to Choose Death." He says, consider Perry Bridgman, the Nobel Peace Prize-winning physicist who at age 79 was entering the final stages of terminal cancer. Racked with pain and bereft of hope, he got a gun and somehow found the courage to pull the trigger, knowing he was condemning others to the agony of discovering his bloody remains. His final note said simply, it is not decent for society to make a man do this to himself. Probably this is the last day I will be able to do it myself. The right to life implies the right to death. Patients already have the right to refuse treatment to prolong their life. Nowhere in the Constitution does it say or imply that the government has the right to prevent someone from committing suicide. After all, if a patient and a family agree that is what they want to do, who is to stand in their way? In a country that is supposedly free, this should be a fundamental right. Most proponents of PAS say that what they want most is a choice of how their lives will end. They want to die around the people they love most in a controlled environment. PAS is a compassionate and humane act that allows for a patient to leave the world on his or her own terms, as quick and pain-free as possible. PAS allows for a competent, terminally ill patient to have a better quality of life, because what good is life living if you're constantly in pain, if death is constantly knocking at your door? These are all issues terminally ill persons must live with day in and day out. The loss of self-control, self-respect, self-dignity add to an already poor quality of life. One should have the right to say enough is enough. Carl Wilhelm, a PhD recipient from Harvard University, as well as a philosophy professor and author on human rights, explains in his 2009 article titled "Assisted Suicide Should Be a Legal Right." that one's life is a biography, experience is a drama with a beginning, middle, and an end, such that the intrinsic value of each part is determined much more by one's awareness of its significance for the whole than by the felt pleasantness or painfulness. The awareness that one will die without dignity can undermine one's self-respect and cause one to devalue one's life. The loss of patient dignity also affects how others remember them and reduces, at least to some degree, the respect for them. This is an injury to the patient, who must now expect to be remembered less fondly and with less respect than they would wish, and a misfortune to the family and friends who condemned to live on with the distressful memories of the death of their loved ones. In conclusion, terminally ill patients have a tough enough road to walk down. They should have complete control of how their lives will end, how their last few days, months, and even hours should be played out. Physician-assisted suicides allow for a competent terminally ill patient to eliminate severe pain and suffering in the quickest and most pain-free way possible. PS minimizes distress for the patient and their families while keeping their dignity intact. The terminally ill deserve a better quality of life through compassionate and humane act of physician-assisted suicide.
All right, Kenny, the proposition's identified very clearly. You lay out what the secondary points are a little bit, but I didn't think the citation of the secondary points in the structure was very clear. You developed a lot of issues. Some of them are value-based issues, and so I think you get a little bit off track about pain and suffering and the rights issue. You talk about dignity, and I think that that's perhaps off the track. The question of whether or not there is a constitutional right or if people have a right to decide for themselves, I think you begin to develop that pretty well, and you've got some good authoritative philosophical quotes on those points. I do think, like we talked earlier about in one of the other speeches, that there should be some discussion of what the court rulings are on this particular issue and an explanation about why those rulings are incorrect. Excuse me. At the end, I think you slip a little bit into advocacy of the policy instead of talking about what the benefits would be of taking this particular action. And your first example, the woman that is being discussed on the 60 Minutes interview, doesn't even fit your category or classification because she's unconscious, so she can't voluntarily opt for physician-assisted suicide. Somebody else would have to be deciding for her, so you want to stick to examples that support your position. All right, thank you.